They called it science, but the patients were never told they had become the experiment. Behind hospital doors and government paperwork, bodies were poisoned, infected, and studied like evidence. The worst part is how long the truth stayed buried.
Number 12. Jewish Chronic Disease Hospital. Cancer cell injections. 22 elderly patients were injected with live cancer cells without being told what was entering their bodies. That is the fact that turned a hospital study into a consent landmark. In 1963, at the Jewish Chronic Disease Hospital in Brooklyn, Dr. Chester M. Southam of the Sloan Kettering Institute ran cancer immunity research on chronically ill hospitalized patients, assisted by hospital physicians. The stated goal was to see how human immune systems rejected cancer cells, but the consent forms did not disclose the cancer cell nature of the injections. 3 doctors inside the hospital refused to participate, recognizing the ethical line being crossed. The New York State Board of Regents later placed Southam and another physician on probation. Here, deception hid inside medical paperwork. Next, it hides inside a club.
Number 11. Fernald State School Radioactive Science Club. The reward was membership in a club. The food was radioactive. At the Walter E. Fernald State School in Waltham, Massachusetts, institutionalized boys were recruited into a so-called science club between 1946 and 1953. Fernald held children and adults with developmental disabilities, and many boys were labeled feeble-minded, a category institutions used to strip away meaningful consent. Researchers from MIT, Harvard, Massachusetts General Hospital, the Atomic Energy Commission, and Quaker Oats linked funding fed the boys cereal, milk, or meals containing radioactive iron and calcium to measure nutrient absorption. In 1946, one study exposed 17 subjects to radioactive iron. Parents and guardians were not adequately told this was non-therapeutic research, or that the food was radioactive. The 1998 settlement paid $1,850,000. The boys had been invited to belong, then used as instruments. Number 10. Vanderbilt Pregnancy Radioactive Iron Study. The experiment began before some of its subjects were even born. In a 1969 follow-up, researchers found 3 childhood cancer deaths in the exposed group and none in the controls. At Vanderbilt University in Nashville, Tennessee, poor pregnant clinic patients were given radioactive iron mixtures during prenatal care, mainly from 1945 to 1947. Researchers said they were studying how iron moved from mother to fetus. The work sat inside the wider Manhattan Project, an Atomic Energy Commission system of human radiation research. The women were told the mixtures were routine supplements. They were told nothing about radiation. Their children were later tracked through medical records after birth. You can see how consent disappeared inside clinic language. Prenatal care was the cover. The fetus was the instrument. Number 9. Manhattan Project Plutonium Injections. A hospital chart could turn a patient into a weapons data point. Between 1945 and 1947, Manhattan Project and Atomic Energy Commission linked researchers secretly injected radioactive plutonium into 18 people at sites connected to Oak Ridge, Rochester, Chicago, and San Francisco. The goal was to learn how plutonium moved through the body, tracked through urine, feces, blood, and tissue samples, because the bomb program needed human distribution data. Ebb Cade, an African-American cement worker injured in a car accident near Oak Ridge, received 4.7 micrograms on April 10, 1945. Albert Stevens, coded CAL1, received one of the highest known lifetime doses from such an injection. A 1994 federal inquiry later exposed the pattern. The next step would move from the body's organs to the mind itself. Number 8. Allen Memorial Institute. MKULTRA Psychic Driving. Patients entered the Allen Memorial Institute for depression, anxiety, or postpartum distress. Some left with shattered memory and lasting psychological injury. In Montreal, from 1957 to 1964, Dr. Ewan Cameron ran CIA-linked MKULTRA-funded experiments on psychiatric patients, including Linda McDonald, who later said she lost much of her past. Cameron called the first stage depatterning. Patients were kept in drug-induced sleep, exposed to sensory manipulation, and given electroconvulsive therapy at levels described as far beyond normal therapeutic use. Then came psychic driving, taped messages repeated for hours or days, meant to reprogram what Cameron believed was a blanked-out mind. You can see how consent disappeared behind clinical language. This was not treatment gone wrong. It was trust converted into research material. Number 7. Cincinnati total body irradiation experiments. A hospital visit became a data point for nuclear war planning. Some patients thought they were receiving cancer treatment, while the study also measured how a human body might function after radiation exposure. At the University of Cincinnati College of Medicine and Cincinnati General Hospital, radiologist Dr. Eugene Sanger led total body irradiation experiments mainly from 1960 to 1971. Around 88 to 90 seriously ill cancer patients received large whole-body or partial-body radiation doses, with support in part from the United States Department of Defense. The subjects were poor, many were African American, and they were not clearly told the military purpose or the full risks. Families later sued, and the university settled in the 1990s. Here, the language of care covered the needs of the battlefield, and next, that logic moves into a place where refusal was even harder to imagine. Number 6. Holmesburg Prison, Acres of Skin Experiments. A dermatologist walked into Holmesburg Prison and saw, in his own words, acres of skin. From the early 1950s into the mid-1970s, Dr. Albert M. Kligman of the University of Pennsylvania ran tests on inmates in Philadelphia. The men were disproportionately poor and disproportionately men of color. They were paid, often about $1 to $2 per session, inside a prison where cooperation could shape a man's access to money, work, and medical attention. The studies tested cosmetics, pharmaceuticals, radioactive isotopes, infectious agents, chemical burns, dioxin, and psychoactive agents like LSD and BZ. One Army-funded study examined poisonous vapors on skin. In 1965 and 1966, Dow Chemical paid $10,000 to expose roughly 75 prisoners to dioxin. Consent did not vanish in secret. It was priced, processed, and signed. Number 5. Willowbrook State School, Hepatitis Experiments. Admission to Willowbrook could come with a condition. Your disabled child entered a hepatitis unit, where researchers deliberately exposed children to the virus. At Willowbrook State School on Staten Island, New York, Dr. Saul Krugman of New York University led hepatitis studies mainly from the 1950s into the 1970s, with major work beginning around 1955. A published pediatrics article in 1958 reported about 400 cases of infectious hepatitis with jaundice there since 1953. Researchers studied transmission, illness progression, and prevention, including gamma globulin, sometimes by having children ingest viral material. Willowbrook was badly overcrowded, reportedly at 250% capacity in the 1960s, and the hepatitis unit could mean a shorter wait. You can see how a bed became leverage. Consent was not free. Number 4. Tuskegee Syphilis Study. For decades, federal doctors withheld a cure from black men who already needed it. In Macon County, Alabama, from 1932 to 1972, the United States Public Health Service ran the Tuskegee Syphilis Study, using Tuskegee Institute's name to lend trust and legitimacy. 600 black men were enrolled. 399 had syphilis. 201 served as controls. They were told they had bad blood. Doctors withheld the real diagnosis and, after penicillin became standard in the 1940s, withheld the cure too. Whistleblower Peter Buxton helped force the study into public view in 1972. A $10 million settlement followed in 1974. President Bill Clinton apologized on May 16, 1997. Bad blood was not a diagnosis. It was the architecture of deception. Number 3. Guatemala STD inoculation experiments. The file sat buried for decades until a historian found the paperwork of an experiment that officials never publicly defended. From 1946 to 1948, the United States Public Health Service ran disease inoculation studies in Guatemala City, the National Penitentiary, military barracks, and a psychiatric hospital, with Dr. John C. Cutler as a key figure. Prisoners, soldiers, sex workers, psychiatric patients, and children were exposed to syphilis, gonorrhea, and chancroid to test prevention and treatment. Records show at least 1,308 people were exposed or infected, including at least 497 syphilis inoculations, with 87% showing signs of infection. Only about 26% were documented as completing treatment. The United States apologized in 2010. Here, consent was not overlooked. It was engineered out of the room, and the next case pushes that logic into childhood itself. Number 2. Nazi Neuengamme tuberculosis experiments on children. 20 Jewish children became evidence the perpetrators tried to erase. At Neuengamme concentration camp in Hamburg, SS physician Kurt Heismeyer used them for tuberculosis research in 1944 after they were transported from Auschwitz. He injected live tuberculosis bacteria directly into their lung tissue and scratched it into their skin, documenting infection as it advanced. The victims were children, but the paperwork treated them as material. As Allied forces closed in, the research turned into concealment. The children and their caretakers were taken to the basement of the Bullenhuser Dom school in Hamburg. On April 21, 1945, shortly before Germany's surrender, they did not survive. Auschwitz supplied the victims. Neuengamme ran the experiments. Bullenhuser Dom finished the crime. Number 1. Japanese Unit 731 Vivisection Experiments. At Unit 731, surgeons operated on living prisoners without anesthesia. The Imperial Japanese Army ran the unit in Pingfang, near Harbin, in occupied Manchuria, from 1936 to 1945, under Shiro Ishii. Its victims were Chinese civilians, prisoners of war, Koreans, Russians, and Mongolians. People reduced first to categories, then to material. Inside the system, they were called marutas, logs. Prisoners were exposed to plague, cholera, anthrax, and typhoid. They were frozen for frostbite trials, subjected to pressure experiments, used in weapons tests, and operated on while still alive. Historians estimate at least 3,000 people lost their lives inside Unit 731 facilities, with many more not surviving field biological attacks. After the war, many personnel avoided prosecution by giving data to United States authorities. The final injury was not secrecy alone, but usefulness.